Today we will be showing how to properly pack a cord and take a polyvinyl siloxane impression for a PFM crown on number 8. The armamentarium for this procedure includes 2 dispensing guns, caulk tray adhesive, a timer, light body PVS material regular set, heavy body PVS material regular set, 2 mixing tips, an intraoral tip, a custom tray, cord, and hemodent. Prior to packing a cord, make sure your patient is anesthetized, preferably with 1 to 50,000 epi to decrease bleeding. For purposes of this video, please assume tooth number 8 is prepped for a PFM crown. Before starting, make sure area is dry. Start packing the cord in approximately, making sure that the gingiva stays dry. If bleeding occurs, use clear viscostat on an anterior tooth. Continue to pack the tooth in small increments. After first compression cord has been packed, wait 5 to 7 minutes, then pack the retraction cord in the same manner you did previously. Start packing the cord in approximately, making sure the gingiva stays dry. Use the largest retraction cord that can fit in the sulcus. To show how to properly take the impression, we will be using a Typinot with the prep tooth. Select and/or prepare a suitable metal tray, a firm disposable tray, or a custom tray. Use rigid trays of sufficient size to provide at least 2 to 3 millimeter thickness of impression material. Brush a thin layer of caulk tray adhesive onto the tray surface that will be covered with impression material and allowed to air dry for at least 5 minutes, but no more than 30 minutes. Avoid placement of excess adhesive onto tray surfaces. Retention will not be enhanced and may be compromised by placement of a thicker layer.
Alright, the first thing you have to do is you have to bleed the material through the auto mixing tip. Then we're going to start by pulling the retraction cord slowly out of the sulcus, following with the light body material all the way around the tooth. Once you have that ready, you're going to use the air syringe with low pressure air to push the light body material deeper into the sulcus. The next step would be a second layer of light body material.
As the dentist is loading the light body onto the prep, have another assistant load the heavy body onto the tray. Make sure to load the tray completely. Then have the dentist seat the tray the loaded tray. The tray must be seated within 1 minute and 10 seconds from time of first introduction of the light body material intraorally. Retain the impression in position until firmly set. Check the impression in the mouth to be sure it is firm, resilient, and non-tacky before removal. Remove impression by pulling slowly to break seal, then snap out along the long axis of the tooth. Make sure that you have captured all of the margins of your prep.
We hope you enjoyed our video!